NPTE StudyCast.
All right, welcome to NPTE StudyCast. We're taking a look at TBI, traumatic brain injury, with Bridget Ripa. Bridget, this is your thing. This is your jam.
I love it.
TBI, what is it? How do you briefly describe it?
So the best way I would describe it is an alteration in brain function or other evidence of some sort of brain pathology caused by an external force. So that could be a fall or motor vehicle accident or being struck in the head by an object or another person, some sort of assault, things like that.
So there could be a lot of different causes. What's involved besides the obvious brain?
Right, so it kind of depends on whether it's an open head injury versus a closed head injury. So an open head injury would be an object penetrates the skull and enters the brain, versus a closed head injury would be an external force or some sort of violent movement that causes the brain to knock up against the inside of the skull.
Right.
So I think part of that matters, but then there are also different types of those injuries. So there's DAI, which is a diffuse axonal injury. There's contusions, there's coup and contra-coup injuries, there's penetrating injuries, which we already kind of talked about, and then there's hematomas.
So what else could it be? Let's do a differential diagnosis.
I think some of the big ones that come into my mind are seizures, hydrocephalus, infection, edema, tumors, hypoxia or ischemia, and then a lot of patients with TBI also present like a CVA, because a lot of times there's a subsequent CVA after the brain injury, or there's a bleed after the brain injury or something like that.
So you got to think about those things when you're looking at someone like this.
Special tests.
How do you prove it or disprove it? What are the tests that someone would have if a TBI is suspected?
So again, CT is going to be the first thing that's done in the hospital setting, just because it's quick, it's easily available. There might be a follow-up MRI, but then there are also certain behaviors specific to patients with TBI that you can look at, and using some of those outcome measures. The one that's most widely used is the GCS, the Glasgow Coma Scale, and that's usually given when patients are in the field, when they first arrive at the ER or the ED, and then kind of throughout their rehab process. And then there are other things such as the agitated behavior scale, the coma recovery scale, and then of course what we all probably know the best is the Rancho levels of cognitive functioning.
Yeah.
Treatment examples.
Okay, great. Now, what does a PT do about it? What are some treatment examples? What does working with a patient with a traumatic brain injury look like?
Again, I always go back to the ICF model and the body function and structure impairments, the activity limitations, and the participation restrictions. But I also consider where the patient is in that Rancho level of cognitive functioning, because that's going to guide my treatment a lot more. You're still going to address all of the same things that you do with a lot of the neuro patients that you see. So neuromuscular reeducation, weight bearing, tone management, aerobic training, and then you're still going to consider your overall neuro exam with sensation, perception, communication, cognition. And then specifically with these patients, you really want to look at their executive functioning, their dual tasking, and their ability to kind of just process information.
Here's your example question.
What's a sample NPTE question? How will they approach it?
The big thing with patients with TBI is looking at their behavior and how, as a therapist, we can facilitate or modify to get certain behaviors in order to maximize their recovery and their function. A question might be, a therapist wishes to use behavior modification techniques as a part of a plan of care to help shape the behavioral responses of a patient recovering from TBI. The best form of intervention is to, and then the answer would be, use frequent reinforcements for all desired behaviors.
Perfect. That's TBI for the NPTE in just a couple of minutes.
NPTE StudyCast. Brewed by the PT Pintcast.